Dr. Jenkins. My name is April Harrison. I'm a student nurse, and I am just going to be doing a couple of things with you today, if that's okay?
Mm-hmm.
All right, the whole process will probably take 20 minutes at max. I'm going to go ahead and just take a brief history, and I'm going to do a head to toe inspection on you, kind of take some vitals and everything, okay?
Okay.
All right. Let's go ahead and start with, if you can verify your name and date of birth.
Bob Jenkins, 12/27/79.
Okay. Go ahead and see here. Very good. All right. Let's go ahead and start off with age.
40.
40. All right. Let's go over to the correct side here. 40. And can you tell me what you're in here for today?
Stomach pains.
Having some stomach pains. Can you tell me where?
Bottom left of my stomach.
Bottom left. When did those start?
Over the last week.
Over the last week. Okay. Do you know if you've had any injuries or anything to bring this about?
Mm-mm.
No? How's your diet? Are you able to eat?
Yeah, a little bit.
Little bits. Have you had any nausea or vomiting?
No.
No? When was your last bowel movement?
Couple days ago, 3-4 days ago.
3 or 4 days ago? Okay. Can you tell me about it? Can you tell me how the consistency was on it?
It's just painful to try to use the restroom.
Painful to try. Have you had any like bloody stool with it?
Not that I know of.
When you had it? Okay. Can you tell me, was it small, medium, large amount that you were able to get?
Small.
Small. And could you tell me if it was like pebbly or bumpy or?
Don't remember.
Don't remember. Okay. All right. Then let's go ahead. Have you had this issue before?
No.
No. Okay. All right. And then have you had any other? Do you have any other medical diagnoses that, like asthma or
No.
any
No
heart issues, breathing issues at all?
No.
Do you take an inhaler?
No.
No? Okay. All right. Have you had any surgeries in the past?
No.
Never?
Mm-mm.
Okay. All right. And then do you smoke?
No.
Drink?
No.
Have you in the past?
Very little. Socially only.
How long ago was that?
Years.
All right. And then let's go ahead then. We're going to take your vitals. I noticed that his body structure, he sits up in bed fine, and his coloring is good. All right. I'm going to go ahead and take your blood pressure. Put the blood pressure cuff on. I'm going to take your pulse ox and temperature, gloves on, sanitize, put it in the sleeve. Okay. Okay. And that's still going. Respiratory was 18. Blood pressure was 130/75. Pulse ox is 97. And we're still waiting on temperature. And beep, 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 beep. Oh, perfect. Okay, 90 98.7. Throw away the sheath, sanitize, put away, dispose of my gloves. Okay. All right, so let's go ahead then, and I'm going to look you over from head to toe. I'm going to put on some fresh, clean, new gloves, and I'm going to start inspecting hair. And hair has even distribution of hair. There is no bumps, bruises, lesions, open wounds, or anything that can be felt. I'm going to feel around the ears, same thing. Looking inside the ears, they look clear and clean. Same thing on this side. All right, no bulges coming out of the neck. I'm going to go ahead while I'm here. I'm just going to go ahead and feel the carotid artery. And I can feel a good pulse on that side. Same thing on the other side. So he has 2+ on right and left side. Whenever I took his pulse on this side, he had 2+. And I'll just go ahead and do a quick check on this. Same here. All right. And then I'm looking over his skin. He has good turgor, so he's not dehydrated. Good skin coloring. I'm going to go ahead and look at your leg real quick. Just going to reveal this side. Nice even hair distribution. Skin coloring on here is nice. I'm going to go ahead and just feel for his pulse. And I can feel it just fine. Excuse me. And then I'm going to go ahead. I need to feel for your pulse here. All right. We've got a 2+. We have capillary refill is quick on these. Definitely less than 3 seconds. Go ahead and reveal this side. Good. Okay. And his pulse on over here is definitely 2+ on those. Okay, and nice capillary refill on that also. I'm going to go ahead and throw my gloves away since I was touching his feet. And I can don new gloves, clean my hands. And I'm going to go ahead and check the refill on his fingers. Nice capillary refill. He does have a shortened finger. There is really no capillary to check on that one. And I can make a note about this finger. Okay, and then I'm going to go ahead and let me check lung sounds real quick. All right, so I'm going to check lung sounds and I'll check heart rate at the same time as I'm going about listening to the lung. If you'll go ahead and take a deep breath in. Now I'm going to go ahead and check your apical pulse. Okay, he had a 2+ on his pulse also. He had clear lung sounds in all lobes. I heard no crackling or any other abnormal lung sounds. And I'm going to go ahead. Did I assess your pain? Can you tell me what your pain is?
Probably a 6.
A 6? Okay. Are you able to sit up, or do you need to just roll over to your side?
No, I can sit up. It's just uncomfortable.
Okay, well, we can just go ahead and roll over to your side. I don't want you to be in unnecessary pain.
So I'm going to roll over?
Yeah. If you can roll over that way without too much strain. Oh, look at you. You're really good at that. Okay. Now I'm just going to go ahead and listen to the lung sounds. Okay. And all lobes sounded clear on the listening from the back also. And as he's laying on his back, I'm able to assess his skin and see that he has no bruises or open wounds on his skin, no rashes. Everything has been warm to touch and dry. And as he's also on his side, I'm going to go ahead and just look at the coloring on his legs and the hair distribution on his legs, and looking for any wounds or bruises also. From here, I'm able to check the popliteal pulses. Those are good. Did I redo your feet? Checking pulses on the tops of the feet. Behind the ankles. And I believe I already did this. Capillary refills. Too many ticks. Okay. All right. And if you would like, you can go ahead and roll back over. Okay. I'm going to go ahead and clean my hands again. And let's see, I've already checked your pulses. You're not helping me out at all. Have you had a flu vaccine this year?
No.
Have you had a pneumonia vaccine?
Pneumonia
For
vaccine?
not ammonia.
Negative.
Okay. How often are you able to eat? Do you eat like regular meals?
Yeah, regular meals, just really small right now.
Really small. Okay, since the onset of your pain?
Mm-hmm.
Okay, so can you tell me what you have been eating the past few days?
Just regular food.
Just
Real small sandwich for lunch.
okay.
Small dinners.
Okay.
Nothing special. Nothing really bad.
Okay. Are you able to eat protein?
Mm-hmm.
Do you how many times a day would you say you eat protein?
2 to 3 times.
2 to 3 times? Okay. All right. So based on the way he's able to move in bed, are you able to get up and walk around?
Yeah.
You are? Okay. So based on the information that he's given me with his diet and his being able to move around and everything, then I'm going to say that Braden scale wise, we do not have a concern for getting shearing, friction, bed sores, or any kind of issues like that. He would be like a 19-20 on the Braden scale. And let's go ahead. I'm going to go ahead and give you an exam on your abdomen real quick, if that's okay. So we're going to lay your bed back. Okay. All right. And I'm going to go ahead and just from looking at him, he didn't have a barrel chest whenever I was doing all of the listening to the cardiac and lung sounds and looking at his stomach. He doesn't have a scaffolding kind of stomach. He doesn't have a protuberant stomach. I would say it's just basically fairly flat. And then I'm going to go ahead and as I'm looking, I'm inspecting to see if we have any raised areas. The area of concern does look like it's a little bit protuberant over here in the lower left quadrant. I'm going to go ahead and listen to bowel sounds. I'm definitely hearing active bowel sounds in every quadrant. And now I'm going to go ahead and just feel around. Okay, I'm going to tap, but be kind of careful over the area. I don't want to tap hard. Okay. Definitely am feeling a raised area over here. And now I'm going to go ahead and okay, tell me if I'm causing pain.
Just discomfort.
Discomfort. Okay. Now I'm going deeper the second time. Gotta relax. Okay, and I'm not going to go deep in the area of pain. Okay. All right. All right, so I'm going to note that on his lower left quadrant, we do have bowel sounds. However, we do have an odd protuberant structure over here. So note that. Okay. And can you tell me, as we're talking here, can you tell me a little bit about your home? Do you have a family that you live with, or do you live alone?
Yeah, family.
You have family? Okay. All right. And let's see here. Can you tell me if you feel safe at home?
Mm-hmm.
Yeah. And how do you feel about yourself? How are you feeling emotionally right now?
Good.
Good. Okay. All right. Have you experienced any weakness or anything?
Mm-mm.
No weakness? No numb or tingling anywhere?
No.
All right. And let's see here. We've already done capillary refill, lung sounds. We've already established that you're not on oxygen, and you already told me that you didn't take an inhaler for anything. Okay. And then the breathing is regular, so we don't have any issues there. We've heard bowel sounds. And then as far as nutritional assessment, he's already said that he's eating a little bit less than normal. However, he's able to still eat some. He's able to still eat protein 3 times a day right now. But he has said that he eats less. So we'll note that. And then we've already discussed his bowel movement and your glucose. When we tested your glucose, it was at a 70. So we're good on that. So is there anything that you want me to report to the nurse right now?
Nope.
No? Okay, well then I'll go ahead and let her know what you've told me about your pain level. And I will come back in and check on you throughout the day. I'm going to go ahead and leave you a call light. If there's anything that you need, you let me know, okay?
Okay.
Okay, wonderful. And do you want me to set your bed back up, or are you comfortable?
No, I'm good.
Okay. All right.